to meaningful use portal. Connect them to meaningful use portal so that the government will start recording, because they have 3 months window. It is not based on number of patients they see. It's based on how if they use it every day for 3 months.
You say meaningful data?
Meaningful use portal. Meaningful use portal. So we're going to train you also how to set up meaningful use portal. Now you are going to be in this team, right? And anywhere you go, each doctor, right, we have to pay $2,000 for the front end, and each nurse they have, or each nurse they have, or each practice staff they have, we pay $1,000 because you have to teach them. The doctors must be taught, the practice must be taught. Then when you do that, your own income is going to be $400. And so the first money they may pay you half, you're going to get your money front end.
Then your income is $500?
Yes, they're going to pay you. And because you're going to have 2 field trips, 2 field jobs. You will bring a doctor from your own. They will give you a medical practice. So you're going to have 2. But you have to supply 1 before. The reason when you go to a place you know, somebody you know, if you mess up, they will tolerate you. They will give you another one that you go and do. Once you can do 2 successfully as an intern, which will earn about $1,000, then you also believe that you're going to do the certification, then we can take you to become a partner. And the partners share at the back end the money they're going to pay them. Because they're going to pay each doctor for Medicaid $44,000. For Medicaid, they're going to pay them $64,000. And if they don't do them, they will not be allowed to treat any Medicaid and Medicare patients. Let me tell you, in this country, the people that run the medical system here is the government. Most hospitals, most clinics, 75% of their income is from government. But the government gets paid, they get paid through the insurance. So there's a middleman in the middle, who is the insurance. And that's why it's more expensive. US pays 16% of the GDP on healthcare. And US has the lowest of all the age expectancy among developed countries. In Europe, they pay only 8%, but government, they don't allow the insurance to come in between. So that was the reason why Obama was trying to say that we should have universal health, and they said no. And he said, okay, let's have government options. He said no, because they still wanted to put the insurance in between. But the point is that every lady that has had a baby in US, when the baby is to be born, they will ask you, they will do your blood grouping, because they know that you can need blood. But anytime you want to have another baby again, they'll still do blood grouping and genetics for you. Waste of time, waste of money. It's a waste of money, and that's the reason why the Obama is saying that this needs to be stopped, and it has already been approved. It's already passed. It's just like what we have, no child left behind. Even if Obama is not there, they will still go through it, because the tax law, the Bush tax rebate, Obama said how to honor it. So even if not there, this thing, the doctors don't want it, because it makes life easier for them. Many people die, 8% of people die in the US due to medical errors. If you go to a doctor today and say you are sick, all right? The doctor wants to, because doctors are paid based on number of patients they see. You just want to treat you for sickness. It doesn't, if you are hypertensive, you may not even know. Right? So if you use some drugs, there can be contraindications. Drug interaction, people will die. 8% of people die, millions of people die every year. So this one, as soon as he enters your data in, right, and he kicks into the health record, the point is that your hypertensive thing will come up. So if you give a drug, they'll be an alert and say, look, you can't give this patient this drug. So that's the reason why they all need to use iPad. Because iPad you can use your hand, you don't have to write anything. So the same thing they do on paper, they can do on this. And as long as they do it, goes straight into the system. Now, we're going to talk about what is EHR and what is EMR. Because we're going to have some quizzes as we go ahead. Then after that, we're going to do installation, which is the first step. Then you're going to have an homework of a patient medical history, which you go and enter into the software and then you email it to us. And then we know that you're going to do it. If you now know that the next stage is for you to identify your own one first field trip, we go along with you.
Okay.
Then, just to make you comfortable, we will introduce to them many doctors, or many millions and thousands of doctors in Georgia. Thousands of nurses. If you don't do it, you will not be allowed. So everybody must know how to use it. And the easiest way for you to know how to use it is to have an iPad. Because once you set it up, everything you see, just like a computer, you can do there. You can enter the name of the patient, just like you did just now, and everything goes in. But as again, write it down. And when it goes there, anybody can pull it. Is it making sense?
Mm-hmm.
But please, the most important thing is the law. What you see.
Okay.
If you tell, government will tell you. And that means jail. So please look. So let's quickly look. We're going to go through some PowerPoints, and then we're going